One of the most important areas of dental treatment is TMJ therapy. The truth of the matter is patients suffer with headaches, neck aches, and earaches. They've been to physicians, they've been to specialists, ENT specialists, sometimes even neurologists, and cannot find the cause. Well, the truth of the matter is dental stress, the way your teeth come together when you bite and chew, and the temporomandibular joint, TMJ, are often a serious contributing factor to headaches. Some of the symptoms that we will see could be things like headaches, neck aches, earaches, loose teeth, sore teeth, broken teeth, worn teeth, dizziness, ringing in the ears, stress-related things. Although these can be caused by a lot of other reasons, often the dental stress is one of the major contributing factors. I got started treating TMJ problems myself because I had incapacitating migraine headaches. And on the average of about once a month, I would have a headache so severe that I couldn't even drive home. It would be accompanied with nausea, vomiting, a throbbing headache. I always said I had to get better to die. I'd go home, go to bed, put a wet rag over my forehead, and probably sleep for 16 to 18 hours, wake up, finally rested, and get on with my life. And this had been going on since I was a teenager. About 36 years ago, a friend of mine mentioned that he'd been treating some TMJ problems, and maybe I had to come over to his office and he'd take a look. So I drove over to Ludington, we diagnosed, came up with a treatment plan, treated my headaches, and they went away completely. I have not had a headache like that for 36 years. So with that as a background, I said, I'm going to take a look into this. So I started doing extensive study into treating TMJ problems. So one of the things I found was in my studies was that about 50% of all visits to a physician, family practitioner, are for either headaches, neck aches, or back pain. In fact, 43% of patients who are normally healthy have headache and back pain. So that was kind of interesting. So in treating, I had completed the first phase of treatment and was ready to start treating my patients. The very first patient I treated had what she described as headaches, facial pain so severe that it dropped her to her knees. She said it was like someone taking a razor blade and scraping inside of her bone. She had been to the military hospital for a diagnosis. Finally, they could not find a reason. They were going to sever the sensory nerve of one side of her face, so basically her whole side of her face would be numb. And that's when I saw her. We did an examination, did diagnose a temporomandibular joint TMJ problem, and commenced treatment. Upon completing treatment, I called her the next day to see how she was doing, because obviously my first patient, I was very excited. She said to me, "You know what, I've been up all night." I think, oh my gosh, I've killed her. She says, "I feel so good that I was up all night eating. I cannot tell you how good I feel." It's now 36 years later, and this patient has been pain-free for 36 years. So you can imagine having something that so dramatic happen. So we have aggressively treated TMJ problems since then. So treatment is pretty straightforward. Once we've done a history of the patient, and as I said before, headaches, neck aches, earaches, loose teeth, sore teeth, broken teeth, worn teeth. Once we've done a history and done an examination and diagnosed a TMJ problem, treatment is the fabrication of an occlusal bite splint. Basically, a bite splint is worn. We make them so they fit on the top teeth. Some people make them so they fit on the bottom teeth. But a bite splint allows the patient to close together with her jaw in a comfortable, stable position. And what we found is if we make that and modify it, adjust it, treat it over a 3 to 4 month period, we've had unbelievable success treating TMJ patients. Sometimes in complex cases, we'll actually take the patient's case, mount it on an adjustable articulator so that we can actually check and see what we're going to do. We'll mark the teeth, examine where they're hitting, and then make adjustments to them so we'll know whether or not we can effectively treat TMJ problems. Once the bite splint has worked and everything is stable, then we have to decide what do we need to do to the teeth to make them work like that bite splint does. Sometimes it's just a matter of adjusting the high spots on the teeth. Sometimes it's a matter of crowns and bridges so that the teeth hit properly. Some patients, they need orthodontics. Some patients need surgery as complex as that, and some people need a combination of all those things. But the nice thing about the bite splint is it's therapeutic. It works to help relieve the problems. It's diagnostic because we confirm whether or not it is a TMJ patient problem, and then third, it's reversible. So if we make a bite splint and it doesn't work, we can just take it out and the patient is at least where they started. That's basically some of the history of how we get started treating TMJ patients, one of the most successful cases and dramatic cases we've seen, and why we've spent so much time and emphasis on it for the past 35 years and continue to do that. If you're experiencing any of these symptoms, headaches, neck aches, earaches, that you cannot find a cause for them, it's very simple to have a dental examination. It consists of a history, find out what the history is, what's going on, an examination to find out if indeed the teeth and the jaws and the temporomandibular joint are contributing factors, and then a consultation to discuss how we would treat it. Treatment starts out with a bite splint, which is something that you just wear at night in most cases, and then proceeds to whatever we feel then is the best course of treatment. So if that is a problem, just feel free to call the office. 231-796-4747. Tell them you saw this video and think you might have a TMJ problem.